some dietary supplements may contain unapproved drugs. You might want to stop popping all those dietary supplements. A total of 776 over-the-counter dietary supplements were found to contain potentially harmful drugs. According to a study published in JMA Network Open, 97.6% of the ingredients present in supplements were not labeled on the products. 86% of the contaminated drugs were found mainly in supplements labeled as drugs for weight loss and sexual enhancement, while 12% were found in muscle-building supplements. 1 in 5 supplements were found to contain more than one pharmaceutical drug. Sildenafil, the active ingredient for Viagra, was the most common drug found in sexual enhancement supplements, while sibutramine, a weight loss drug banned by the FDA, was found in weight loss supplements. Dr. Louis Aron, a professor of metabolic research, told Reuters that dietary supplements are hard to regulate as they are often sold and marketed online. According to Scientific American, less than half of the contaminated supplements were ever recalled from stores. Keep watching for more medical stories.
Protecting plants without pesticides. Conventional pesticides are a double-edged sword that scientists are now seeking to replace with more natural RNA-based plant vaccines. Without pesticides, roughly 70% of the world's crops would be lost to pests, but such chemicals are toxic, killing insects but also affecting the rest of the environment. A new approach developed in Finland and France involves directly spraying plant leaves with an RNA-based vaccine that inoculates against specific pests or pathogens. The vaccine triggers a process called RNA interference, which prevents invading RNA strands from carrying out their functions, thus causing the pest to die. RNA molecules in the vaccine do not negatively affect the host plant. The RNA also has the added benefit of being biodegradable because it breaks down quickly. Instead of chemical synthesis, scientists use a bacteria-eating virus called a bacteriophage to help generate the RNA. But with no relevant legislation in existence to govern its use, it's hard to say when the vaccine will be available commercially.
All the vaccine you'll need in one single shot. MIT has developed a drug delivery method that packs multiple doses in a single injection and could soon make multi-shot vaccines a thing of the past. Biodegradable polymers used in implants, sutures, and prosthetic devices were pressed into silicone molds to form tiny cups, each measuring 400 micrometers across. The cups are filled with vaccine and covered with a lid made from the same polymer. Heat is applied to fuse the cap and lid together, sealing the vaccine inside. Varying its chemical makeup allows the polymers to degrade at specific times, though all are delivered simultaneously via a single injection. Inside the body, the vaccine is released once the cup degrades. Lab tests on mice showed the polymer cups successfully releasing their payload in 9, 20, and 41 days without prior leakage. Researchers say the new technology could benefit patients in developing nations, who are often unable to travel frequently to healthcare facilities to complete their shots. It may also allow newborns to be given an injection carrying 1 or 2 years' worth of vaccines, minimizing stressful, tear-filled doctor's visits for kids and parents alike.
Cuba developing a vaccine for lung cancer. America wants in. What's the first thing you think of when you see someone puffing on a stogie? Yup, Cubans, the finest cigars the world has to offer. But it may surprise you to find out Cuba is actually becoming known for its success in treating lung cancer. A new vaccine, Simovax, has been in development in Cuba for a quarter of a century. Simovax targets a growth factor in the body called EGF, which allows cancer to survive. By attacking EGF, the cancer starves and its growth slows, extending a patient's life for as long as an extra year and a half. Early studies with Simovax have shown minimal side effects like nausea, fever, and vomiting, but it's a small price to pay for less cancer. The drug's been used to treat 5,000 cases of lung cancer worldwide, but with FDA approval pending, testing could still be a ways away in America. After the US made nice with Cuba in December 2014, New York Governor Andrew Cuomo went on a trade mission to Havana last year to get the ball rolling to bring the drug to America. Now, there's more hope than ever for the estimated 224,000 plus Americans living with lung cancer.
New hope for HIV patients. University of Maryland and Duke University researchers have designed a new vaccine that was able to stimulate an immune response against HIV's protective shield. HIV virus cells are covered with a protective protein called GP120, which itself is covered by a sugar shield to help bolster its defenses. Some infected individuals who can keep the virus at bay without medication often have antibodies that attack the protein. There has been little success in creating a similar vaccine because the sugars found in the shield resemble sugars in the human body. It's also difficult to engineer antibodies that can be effective against the multiple strains of HIV, which frequently mutate. Using a synthetic chemistry method, scientists have now designed a vaccine combining a GP120 fragment and a sugar molecule and tested it on HIV-infected rabbits. The vaccine prompted the rabbits' immune systems to produce antibodies that physically bound to GP120, found in 4 dominant HIV strains. It takes roughly 2 years to build immunity against HIV, so despite sticking to the virus, the antibodies weren't able to prevent further infection. But the vaccine's ability to induce a strong immune response in a short amount of time is encouraging, and researchers believe further studies can produce a vaccine that can ultimately neutralize the deadly virus.